What are the major challenges in dengue control program in Nepal? Explain in perspective of public health program management. Dengue control in Nepal is a classic example of a vector-borne disease program operating under health system constraints, weak intersectoral coordination, and rapidly changing epidemiological patterns. When analyzed from a public health program management perspective, the challenges can be grouped into key domains. 1. Weak surveillance and information systems. One of the most critical challenges is delayed, incomplete, and underreported surveillance data. Dengue cases are often detected late during outbreaks rather than through early warning systems. Weak routine case reporting from local levels, limited laboratory confirmation capacity outside major cities, poor integration of climate, entomological, and clinical data, lack of real-time outbreak prediction and response systems. These gaps make it difficult for programs to shift from reactive outbreak response to proactive prevention. 2. Limited local-level implementation capacity, decentralization gap. Although national dengue guidelines exist, implementation at provincial and municipal levels is uneven. Local health offices often lack trained staff and entomologists. Weak planning and budgeting for vector control at local governments, limited operational capacity after federalization reforms, dependence on central-level emergency response teams. This creates a policy implementation gap where strong national strategies do not translate into sustained local action. 3. Inadequate vector control and environmental management. Dengue control in Nepal heavily depends on Aedes mosquito control, but implementation is inconsistent. Poor waste management and stagnant water accumulation, irregular larval source reduction campaigns, limited use of integrated vector management, IVM approaches, over-reliance on reactive fogging during outbreaks. Urbanization and environmental conditions further worsen breeding sites. 4. Weak community engagement and behavior change. Public health programs face challenges in sustaining community participation. Limited awareness about mosquito breeding and prevention, resistance to removing household water storage containers, especially due to water scarcity. Inconsistent community participation in source reduction, sociocultural practices that favor mosquito breeding, open water storage, waste disposal habits. Even where awareness exists, behavior change is not sustained, which reduces program effectiveness. 5. Health system and resource constraints. Dengue control is constrained by broader health system limitations. Insufficient trained workforce for outbreak response, limited diagnostic facilities, especially outside urban centers, inadequate funding for continuous vector surveillance, competing priorities with other infectious diseases. These reduce the system's ability to maintain year-round prevention efforts. 6. Poor intersectoral coordination, One Health gap. Effective dengue control requires coordination between multiple sectors, but in practice, weak coordination between health, urban development, waste management, and local governments. Limited engagement of municipalities in environmental control. Fragmented roles and responsibilities. Poor accountability mechanisms across sectors. This leads to uncoordinated and short-term interventions rather than sustained control. 7. Climate change and geographic expansion. From a program management perspective, dengue control is becoming more complex due to expansion of mosquitoes to higher altitudes, longer transmission seasons due to warming temperatures, unpredictable outbreak cycles. This increases the burden on already weak surveillance and response systems. 8. Reactive outbreak-oriented program approach. A major structural problem is that dengue control in Nepal is still largely outbreak-driven rather than prevention-driven. Heavy response during epidemics, weak routine prevention in quiet periods, short-term campaigns instead of sustained integrated vector management. This reduces cost-effectiveness and long-term impact. Conclusion: program management perspective. In summary, dengue control in Nepal is constrained by a combination of weak surveillance and early warning systems, limited local implementation capacity after decentralization, inadequate vector control and environmental management, low and inconsistent community behavior change, resource and workforce shortages, poor intersectoral coordination, increasing climate and urbanization pressures. From a public health program management lens, the core issue is not just technical knowledge, but governance, system integration, and sustained implementation capacity.